Now, talk radio is an insulated world right now. I don't know a lot of people who are thrilled about this health care reform. Many of you are concerned about it. I'm not going to assume that that means that everybody in the country is, but more people are upset about this than aren't. And there are a couple of different people in Congress that are asking for this health care bill to be repealed. And among them is Congressman Stephen King from Iowa, who has written a bill to repeal the Health Care Reform Act. And we welcome Steve to the program. Now, Congressman, how are you?
Well, I'm doing okay, Inga. It's nice to be back with you.
Oh, good. Well, I'm glad to have you. I understand the president's on his way.
He is. Well, I don't know if on his way, but he's going to be in Iowa soon, and I think he's going back to reconnect with the roots of the origin of his movement. To tell them, listen, I stood here a couple of years ago and asked if you'd come support me for president. I'd bring you socialized medicine, and just to simply announce that that's what's been done. He signed the bill, and now this is a victory lap.
Wow. How is Iowa responding to this health care reform?
Well, there'll be people in Johnson County, that's Iowa City, that are absolutely thrilled by it all. And a lot of the other people, I believe, are going to be absolutely sick at heart that something like this could happen and to come out of a movement that started in Iowa. But we are, as a people, we're a proud, independent, self-reliant people. We're the ancestors of people that came out here across the prairie in covered wagons and to live free or die there. They borrowed the New Hampshire state motto. And so we're independent, we're resilient, we're self-reliant, and this bill doesn't give us that. So there are a lot of us that are saying repeal this bill, pull it out by the roots, and we can replace it with some things, but I'm focused more now on sending that message that our commitment needs to be to repeal it, and I want to send that message across Iowa and have that message there before the president gets his statement made.
One of the things that confuses me about this health care bill, Congressman, is that either Republicans are nuts or you stand before a whole bunch of lawyers and people who are well-versed in the Constitution, barring your speaker who had to look at notes to cite the Declaration of Independence. That was tragic. But you're surrounded by, we've got a president who is a lawyer, and yet they seem to be ignoring the blatant constitutional issue with states' rights. How can they do that? How do they justify this?
First, Nancy Pelosi just simply said when she was asked that question that it wasn't a serious question. Let the record show it wasn't a serious question when she was asked where the constitutional authority was to pass this socialized medicine bill. I had a breakfast meeting this morning. I host one every Wednesday morning chairing the Conservative Opportunity Society, and my guest speaker this morning was Attorney General for the state of Virginia, Ken Cuccinelli.
Great.
And he would be one of the leads on this in bringing lawsuits against the federal government. We went through the constitutional argument, not as far as I'd like to take it, but we went down into it a ways. And he says that what we'll see they'll be pushing this argument, trying to get an argument out into the public that the left will argue that it's constitutional, and of course those of us who have taken oath to the Constitution seriously will argue that it's not. There are a number of places in there, and this is my argument. I don't mean to be representing Attorney General Cuccinelli's, but the states' rights side of this, first, there is no constitutional authority. The Commerce Clause that I will argue, and I have, that just because you're born and live in the United States doesn't mean you're engaging in interstate commerce with regard to health care. Mm-hmm. There will be people that are born and live and die without ever having had any health care, let alone any health care that went across state lines that would give the federal government the authority to regulate it as interstate commerce. There's a 10th Amendment component of this, the states' rights issue. This is a power that the states have that falls to them inherently through the 10th Amendment, not a power that the federal government can usurp from the states. So that's a couple of the arguments. First, no constitutional authority, violation of the Commerce Clause, and also violation of the 10th Amendment in the states' rights.
And I'm guessing
there'll be others.
I'm guessing this is a violation of my rights because I am being forced to buy this, whether I want it or not. This is being compelled upon me, right?
It is, and never in the history of the United States has the federal government produced or approved a product that they compelled everyone to buy. And there was a Congressional Research Services paper written on this back in 93 and 4, when Hillary Care was starting to move through this Congress, and their analysis was that there was not a that there was no precedent for it any place in our history then, and of course we know there's no precedent for it now either.
Yeah.
One of the things they argue on the Commerce Clause is a case. The name of that case escapes me, but it has to do with a Supreme Court ruling that there was a gentleman that was raising wheat and consuming his own wheat, and he didn't come and bring it in or out of the state. It was right there in his place. So that precedent that was made established supposedly that he was still involved in interstate commerce because it kept him from buying somebody else's wheat that would have come across the state line. I can't say that stare decisis ought to apply there.
Yeah, I'm not sure I understand even how it applies.
It was a real stretch in that case, and I've just read the briefest of documents on it years ago, and I asked for them to put it in print on my desk today.
Yeah, good.
Next time I'll be a little better tuned. But Inga, there's another argument that I think needs to be made, and that is that ever since 1973, Roe versus Wade, the pro-choice people have made the argument that the federal government has no business telling a woman what she can or can't do with her body.
Yep.
And now here we are, the same people are arguing that the federal government has every business telling everyone in America what they must do and what they can't do with their body.
Well, that goes beyond health care reform, doesn't it? That goes to my state legislature that decides whether or not I can have trans fats and how many calories my children eat at school. I mean,
isn't that outrageous?
It's outrageous.
They will regulate every aspect of our lives if we let them do this. And the Constitution was designed to protect individual rights, the rights of the minority against the tyranny of the majority, to put it in that place in terms. And by the way, Nancy Pelosi said in her closing argument on the floor of the House that health care is no longer a privilege, it's a right. And I'll argue that government cannot confer rights on people. They come from God.
That's right.
If government can do that, then government can take them away, and you have no place to appeal.
That is exactly right. And she quoted that poorly, but she quoted it in her speech, congratulating herself. Congressman King, I want to ask you back on the Roe versus Wade, which of course makes me think of the Stupak Amendment. This is another thing that just on its face, it's blatant. All of us know the president doesn't have the authority to blue pencil, to line item, to write in once Congress votes a law in. The president doesn't have the authority to change it. What does this executive order, what were these people thinking other than, did they think they were going to dupe us?
It's the arrogance of power. It's the arrogance of the troika of power, and that troika is Obama, Pelosi, and Reid.